Hi everyone, welcome to another video of NS Pharma. In today's video, we are going to study 20 important multiple choice questions. These MCQs are very important for the pharmacist competitive exams like government pharmacist exam, Gpat, Niper, drug inspector, and also for the PROMETRIC exams of different Gulf countries. I also included some previous year exam questions in this, so try to do all the 20 questions and comment your score below. Before going into the video, if you didn't subscribe until now my channel, kindly subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. So let's begin.
The first question is Dapsone is an. Dapsone is an. Options are anti-emetic drug, option B anti-leprotic drug, option C anti-anxiety drug, option D anti-tubercular drug. The question is about Dapsone. Dapsone is coming under which category of drug? The correct answer for this question is option B anti-leprotic drug. Dapsone is an anti-leprotic drug. What are the anti-leprotic drugs? Anti-leprotic drugs are classified into 4 types. First one is sulfones. Sulfones. Example is Dapsone. Dapsone is shortly we can write it as DDS, diamino diphenyl sulfone, that is DDS. Okay. Next category is phenazine derivative. Phenazine derivative example is clofazimine. Clofazimine is also a dye. Okay. Next one is anti-TB drug, anti-tubercular drug, which has got anti-leprotic activity. Example is rifampicin and ethionamide. Rifampicin and ethionamide. The last section, that last 4th type of drugs which is coming under anti-leprotic drug is antibiotics, other antibiotics. Examples are minocycline, ofloxacin, then clarithromycin. Okay, minocycline, ofloxacin and clarithromycin. 4 types of drugs are there for the anti-leprotic activity, or anti-leprotic drugs are classified into 4 types. First one is sulfones, second type is phenazine derivative, third type is anti-TB drug, and fourth type is other antibiotics. Now we are moving to the next question, question number 2. Purely synthetic antibiotic is. Purely synthetic antibiotic is. Options are chloramphenicol, option B cephalosporin, option C chlortetracycline, option D penicillin. Which of the following is a purely synthetic antibiotic? The correct answer is chloramphenicol. Option A is the correct answer for this question, chloramphenicol. Now we are moving to the next question. Before that, if you didn't join until now my Telegram channel, you can check the description box. You can click the link for the Telegram channel and you can join. Okay. Now we are moving to the third question. Question is the smallest size of capsule is represented by the number. The smallest size of capsule which is represented by the number. Options are option A 0, option B 4, option C 0 0, that is 00, option D 5. Which of the following has the smallest size of capsule, or the smallest size of capsule is represented by the number, capsule number? Correct answer for this question is option D, that is 5. Okay, 5, capsule number 5 represents the smallest size. It can include approximately 100 milligram of aspirin only. Okay, 5th number, that is 5, capsule number 5 can include, the capacity of the capsule number 5 is 100 milligram of aspirin. What about the biggest size of capsule? The biggest size of capsule is represented by the number 000. Okay, which can include, the capacity of this one is 000. Capsule number is almost 950 milligram of aspirin. 950 milligram of aspirin is the capacity of the biggest size of capsule, that is represented by the number 000. The capsule numbers are 000, 00, 0, 1, 2, 3, 4, 5 in descending order. The capacity in the descending order. 5 is the smallest size. Okay. Now we are moving to the 4th question. Slugging process is used in the following preparation. Slugging process is used in the following preparation. Options are option A capsule, option B tablet, option C powders, option D ointment. Which of the following preparation the slugging process is used? In which of the following preparation slugging process is used? The correct answer for this question is option B, tablet. In the preparation of tablet, we are using slugging process. What is slugging process? Slugging process is a pre-compression method. It is a pre-compression of powders for the formation of large sized tablet. Okay, it is the pre-compression. It is the process of pre-compression for the formation of large or extra large tablets. These tablets are called slugs. Okay, these type of large tablets are called slugs. That is the slugging process. Okay, it is used in the preparation of tablets. Next question, question number 5. Solution of potassium chloride is used in the dash poisoning. In which of the following poisoning for solution of potassium chloride is used? Options are opium poisoning, option B digitalis poisoning, option C atropine poisoning, option D alkaloidal poisoning. The correct answer for this question, that is solution of potassium chloride, is used in option B digitalis poisoning. In case of digitalis poisoning, solution of potassium chloride is used. Why? Because digitalis toxicity makes or produce hypokalemia. Okay, digitalis toxicity causes hypokalemia. The level of potassium will be less during the digitalis toxicity. So we have to use solution of potassium chloride. The antidote of digitalis toxicity or antidote of digitalis is digibind or digitalis immune form. Now we are moving to the next question, question number 6. The source of codeine is. The source of codeine is. Options are option A opium, option B bhang, option C LSD, option D male fern. Okay, the source of codeine is. The correct answer is option A opium. Opium. Codeine is, what is codeine? Codeine is 3-methyl morphine. 3-methyl morphine. That is the codeine. What is LSD? LSD is lysergic acid diethylamide. Lysergic acid diethylamide. Okay, that is LSD. Now we are moving to the 7th question. Question is, the RNA synthesis on a DNA template is known as. The RNA synthesis on a DNA template is known as. Options are translation, option B transduction, option C replication, option D transcription. Okay, the RNA synthesis on a DNA template is known as translation, transduction, replication, transcription. The correct answer for this question is option D transcription. The RNA synthesis on a DNA template is called transcription. What is translation? Translation is the process of synthesis of protein using mRNA from the ribosome or in the ribosome. Okay, translation is the process of synthesis of protein from messenger RNA inside the ribosome. That is the translation. Translation. What is replication? Transduction we will talk after replication. Okay, we will discuss after replication. What is replication? Replication is the process by which a double-stranded DNA molecule is copied to produce two identical DNA molecule. Okay, replication is the process by which a double-stranded DNA molecule is copied to produce two identical DNA molecule. Okay, that is the replication. What about transduction? Transduction is the process of transferring of genetic material. It is the process of transfer of genetic material from one bacteria to another. That is called transduction. So we understood what is translation, what is transduction, what is replication, what is transcription. Replication is the process by which a double-stranded DNA is copied to form or to produce two identical DNA molecule. Okay, now we are moving to the next question, question number 8. How many chromosomes are present in a human cell? How many chromosomes are there in a human cell? Options are 24, option B 46, option C 48, option D 96. How many chromosomes are present in a human cell? The correct answer is option B 46. 46 chromosomes or 23 pairs of chromosomes. Okay, 23 pairs of chromosomes or 46 chromosomes are present in a human cell. Out of this 23 pairs of chromosomes, 22 pairs are same for both male and female. These 22 pairs are called autosomes. Autosomes. The last one, that is one pair which is different in male and female. This is called sex chromosome. Okay, 22 pair of autosomes plus one pair of sex chromosome. That is total 23 pair of chromosome. That is 46 in number total. Now we are moving to the next question. Question number 9. Coma-shaped bacteria is. Coma-shaped bacteria is. Options are cocaine. Option B, bacilli. Option C, vibrio. Option D, spirochetes. Okay. Coma-shaped bacteria is. Options are cocaine, bacilli, vibrio. Then last option, that is spirochetes. The correct answer is coma-shaped bacteria is vibrio. Vibrio. Okay. Option C is the correct answer. What about the first one, that is cocaine? Cocaine is a spherical shaped bacteria. What about bacilli? That is rod shaped bacteria is called bacilli. Now corkscrew shaped bacteria is called spirochetes. What is spirochetes? Corkscrew shaped bacteria is called spirochetes. Okay, now we understood what is cocaine, what is bacilli, what is vibrio, what is spirochetes. Now we are moving to the 10th question. Question is amphetamine is an. Amphetamine is an. Options are CNS stimulant, option B antiseptic, option C astringent, option D all of the above. Amphetamine is an. Option A CNS stimulant, antiseptic, astringent, option D all of the above. The correct answer is amphetamine is a CNS stimulant. That is option A is the correct answer. Now we are moving to the next question, that is question number 11. The drug which is used as a hematinic. The drug used as hematinic. Options are ephedrine, option B vitamin B12, option C vitamin B6, option D vitamin C. Okay, the drug which is used as hematinic. Ephedrine, vitamin B12, vitamin B6, then vitamin C. The correct answer is option B, that is vitamin B12 is the correct answer. Now we are moving to the next question, question number 12. Antiviral drug is. Which of the following drug is antiviral? Options are metronidazole, option B chloroquine, option C interferon, option D quinine. Antiviral drug: metronidazole, chloroquine, interferon, then last option, that is quinine. The correct answer for this question, that is antiviral drug, is option C interferon. Interferon is the antiviral drug. What about metronidazole? Metronidazole is coming under the class anti-amoebic drug. Chloroquine and quinine both are coming under anti-malarial drug. Okay, chloroquine and quinine are coming under anti-malarial drug. These are the questions that came from the classification itself. So you have to by heart all the classification which is in the pharmacology. Okay, if you know the classification of all the drugs in the pharmacology, you can score very well in the pharmacology session. Okay, so you have to study this one very well. Okay, the classification of drug. Now we are moving to the next question, question number 13. The elixirs are sweetened by the addition of. The elixirs are sweetened by the addition of. Options are sucrose, option B glucose, option C dextrose, option D glycerin. The elixirs are sweetened by the addition of. Sucrose is there, glucose is there, dextrose is there, glycerin is there. Which is the correct answer? The correct answer here is glycerin. Option D, glycerin is the correct answer. Elixirs are sweetened by the addition of glycerin. Okay. Now we are moving to the 14th question. Question number 14. An isotonic solution has the same. An isotonic solution has the same. Options are salt content of blood, same salt content of blood. Option B, osmotic pressure of blood. Option C, pH of the blood. Option D, fluid pressure of the blood. An isotonic solution has the same salt content of the blood, osmotic pressure of the blood, pH of the blood, then fluid pressure of the blood. This is a simple question. Anisotonic solution means that is osmotic pressure of the blood. Correct answer is option B. Anisotonic solution has the same osmotic pressure of the blood. That is the correct answer. Now we are moving to the next question. Question number 15. Penicillin V is. What is penicillin V? Options are phenoxymethyl penicillin. Option B, phenoxyethyl penicillin. Option C, that is benzyl penicillin. Option D, procaine penicillin. Okay, 4 options are there. What is the question? Penicillin V is. Okay, the correct answer for this question is phenoxymethyl penicillin. That is option A is the correct answer. Phenoxymethyl penicillin is the penicillin V. What is penicillin G? Penicillin G is benzyl penicillin. That is option C. Penicillin G is benzyl penicillin, or it's also called benpen. That is represent benzyl. Pen represent penicillin. Benpen, benzyl penicillin. Okay, that is penicillin G. Here the question was penicillin V. Penicillin V is phenoxymethyl penicillin. Now the 16th question. Iodophthalin is. What is iodophthalin? Options are diagnostic agent. Option B, general anesthetic. Option C, adrenergic agent. Option D, anti-protozoal agent. What is iodophthalin? The correct answer is option A, diagnostic agent. Iodophthalin is a diagnostic agent. Iodophthalin is derivative of phenolphthalein. Okay, so here iodophthalin is a diagnostic agent. We are now moving to the next question. Question number 17. The Drug and Magic Remedies Act. The Drug and Magic Remedies Act came into force in the year. What was the question? The Drug and Magic Remedies Act came into the force in the year. Options are 1930, option B 1931, option C 1940, option D 1955. Drug and Magic Remedies Act came into force in the year. The correct answer is option D 1955. 1955. Suppose the question came like the Drug and Magic Remedies Act was published. The bill of Drug and Magic Remedy Act was published in the year. Then you have to opt for 1954. In the option which will be 1954. Here the question was Drug and Magic Remedies Act came into force or commenced in the year. Then 1955. The bill is published in 1954 and therefore this act came into the force in 1955. Okay. Question number 18. Sucralfate is used in. Sucralfate is used in. Options are peptic ulcer, option B diabetes, option C angina pectoris, option D epilepsy. Sucralfate is used in peptic ulcer, diabetes, angina pectoris, then epilepsy. Correct answer is peptic ulcer. Option A is the correct answer. This is also a simple question. Question came from the classification of drug against peptic ulcer. Okay, that's why I told you study the classification, all the classification which is coming under the pharmacology. Definitely you will get the benefit for the competitive exams. Okay, now that is the sucralfate which is used in the peptic ulcer. Sucralfate is coming under the class ulcer protectives. Okay, different categories of drugs are there for the peptic ulcer. The sucralfate is coming under the class ulcer protective. Other drug is also coming, that is the drug name is CBS, colloidal bismuth substrate. Okay, CBS, colloidal bismuth substrate is also coming under the class ulcer protective. Okay, now we are moving to the next question. Question number 19. Which of the following could be used as an antidote for the curare poisoning? Okay, which of the following is used as an antidote for curare poisoning? Options are atropine, option B neostigmine, option C homatropine, option D none of the above. In case of curare poisoning, the antidote used is option B neostigmine. Okay, neostigmine is the answer. Option B is the correct answer here. Okay, now we are moving to the last question, that is the drug metabolism mainly take place in? Drug metabolism mainly take place in. Options are liver, option A liver, option B lungs, option C kidney, option D skin. Liver, lungs, kidney, skin. Drug metabolism mainly take place in. The correct answer is option A liver. Liver is the correct answer. Drug metabolism mainly take place in the liver. Okay, these are the 20 important multiple choice questions. Okay, I hope you understood these questions very well. If you have any query regarding these questions, you can ask in the comment section. Thank you very much for watching this video. I hope you subscribe my channel. If you didn't subscribe until now my channel, kindly subscribe the channel and also press the bell button for the notification. Don't forget to share the link of this video with your pharmacy friends. Thank you.